Everyone's getting summertime fine and losing that weight. But what about the excess skin? Let's talk about it. Massive weight loss. It may not be a term that you're familiar with, but as a plastic surgeon, I'm very familiar. And as a plastic surgeon, I see a lot of patients who want to get rid of that excess skin just in time for summer. So let's talk about, in this two-parter, how massive weight loss and body contouring come together. So what is the textbook definition of massive weight loss? It's losing over half of your excess body weight when compared to your ideal body weight. How do we measure ideal body weight? Well, we use BMI, or body mass index, which compares your weight to your height. It's not a perfect measurement, but it is the measurement that we still use to determine what a person's ideal body weight is. Normal BMI is between 18 and 24.9. Above that, we get into overweight and even obesity. Obesity is defined as a BMI greater than 27. How are people losing all this weight? Well, the tried and true methods are still tried and very true. Tested, approved, and trusted according to Burna Boy, right? So they are changes in diet and emphasis on exercise and mobility. Those always work and should be combined with any other method that we described today. Newer methods, and by newer, I mean in the last couple of decades, include bariatric surgery. So that means either changing the size of the stomach or the capacity for it to hold food contents, and or changing how we absorb fat and sugar in our body to limit absorption. Now, the common methods are the bypass and the sleeve gastrectomy, with the gastric bypass being by far probably the most popular that we've seen in the last few decades. The newest methods that are not using surgery are using semaglutides, which are in part 2. Semaglutides, or as we know them on the street, Ozempic, Wegovy. You've probably heard the name. You've heard maybe Ozempic face, or everybody's using Ozempic, which is not true. But they are effective in helping people lose weight as well. And the semaglutides have to date been the most effective medication that we have for weight loss. It helps to release a hormone called ghrelin, which is the hormone in our body that says, hey, you're full. And it also delays how our stomach empties, or the rate in which our stomach empties. So combining those two, you feel fuller, you eat less, obviously you lose weight. So what happens when you lose weight in such a massive way? Well, first you should feel happy, right? Because you had a major feat, whether it was helped by surgery, medication, or you just did it on your own. You did it, period, end of story. But also, people usually have a lot of excess skin. I said a lot, but I mean to varying degrees. But why? Why do they have the excess skin? Well, first is the quality of the skin and the time in which people are losing their weight. So they're losing a lot of weight in a rapid fashion, which means the skin doesn't really have enough time or have the opportunity to retract. Also, when we look at the skin in surgery and on the patient, what we're seeing is that the skin is of poor quality. The tissue is of poor quality. It doesn't really have a lot of remaining elastin, which gives skin that elastic property, right? Skin stretches and snaps back, especially when you're young, a little bit less when you're older, but especially when you're young. But in massive weight loss patients, we don't really see the snap back. Another reason why the skin is of poor quality is that the dermis itself is thin. What is the dermis? The dermis is that layer underneath the skin that we see. And that really is a strength layer of skin. So if that layer is thin, then we're not really seeing a lot of strength in the tissue itself. What does that mean? So what that means is that you're going to end up, if you have massive weight loss, with a lot of ptotic or sagging skin that is of poor quality, that's really not going to snap back. And so there are very few remedies at that point. Actually, there's really only one remedy if that skin bothers you, right? And that is surgery. With that said, because of the lack of elastin or poor levels of elastin in the skin and the dermis being so thin, what I can say about body contouring after massive weight loss is that it should be considered more reconstructive than aesthetic in nature. What are the consequences of having poor skin and going through surgery though? It can mean, one, that the outcome may require revision to get really to a very aesthetic outcome. And it can also mean that the results aren't as durable and may require future surgeries to maintain the look. So how does plastic surgery fit in? Well, let's start with the body, because I think most people come in with complaints about body rather than face. I also should stop here and say, as plastic surgeons, we want you to get the best result that's going to last for as long as possible, right? And so with that being said, the best time to be considered for body contouring is after you've lost all the weight and maintained your weight for at least 3 to 6 months. If you're still actively losing, that is not the time to get plastic surgery. If you're having a problem maintaining it, meaning kind of you're seesawing back and forth, also not the time to get plastic surgery. Now, 5 pounds here or there is not going to make a huge difference. So when I say weight stability, I really want you to be within 5 pounds of your goal and stay there. Let's wake up in the morning, get on the scale. It may read a little heavier, may read a little lighter. And some of that is just water weight and water fluctuations in the body. But anything above 5 pounds is really significant weight that needs to either come off or be added or what have you to maintain stability. This video was so long, I had to divide it into 2. If you like the overview I gave for massive weight loss and body contouring, stay tuned for part 1A, where I go over the actual surgeries that we do for the different body parts. As always, love you lots, and bye for now.